So here we discuss about the anatomy of patella. This is the patella bone. It is the largest sesamoid bone of the human body. Sesamoid bones are those bones which develops within the tendon of a muscle. So this bone, it develops within the tendon of quadriceps femoris muscle, which is a muscle of front of the thigh. It is situated in front of the knee joint. The anatomical features of patella are it has an apex. So this is the apex of this bone, this pointing end of this bone, this is the apex. It is directed downwards. It is rough and gives attachment to ligamentum patelli. Ligamentum patelli is nothing but the tendon of quadriceps femoris muscle. Then we have the three borders of this bone. This is the superior border, and this is the lateral border, and this is the medial border of this bone. It has two surfaces. This is the anterior surface, which is marked by the vertical ridges and some holes in it, and this is the posterior surface. This posterior surface is divided into the articular, the upper 3/4 part of this bone. This is the articular part of this bone, and this lower 1/4 part, which is rough, this is the non-articular part of this bone. This articular part of this bone is further subdivided into medial and the lateral halves with the help of this vertical ridge. So this is the vertical ridge, this is the bony ridge, anatomical ridge, which dividing the body, this posterior surface, into the medial smaller part and the large lateral part. This medial portion is further subdivided by a vertical ridge again into the medial most crest and this medial part. With the help of this diagram, we can understand the posterior surface of this bone. This is the posterior view of the bone. Here we can see this is the vertical ridge which is dividing the posterior surface into the lateral and the medial half. This again vertical ridge divides this medial portion into the medial most crest, this medial crest and the medial half. These are the two transverse lines, the first and the second. These transverse horizontal lines, these are dividing the medial and the lateral halves into three pairs of facets. These three facets are coming in contact with femoral condyles during various movements of the knee joint. For example, the area number 1 comes in contact with the femoral condyles during extension. This area number 2 comes in contact with femoral condyles during slight flexion. And this area number 3, this comes in contact with the femoral condyles during mid-flexion condition. And this medial most crest, this articulates with the femoral condyles during full flexion. So this is the posterior view of the patella, showing the different articular facets which are articulating with the femoral condyles during different movements of the knee joint. Then this is the anterior surface of this bone, which is marked by various grooves, as we can see in the bone. These vertical grooves are because of the tendon of the quadriceps femoris, and these holes, smaller holes, are because of the arteries which are supplying to this bone. So in the next part, we will coming up with the rest of the portion of this bone, that is the attachments and the site determination. Thank you.